Have you ever had to go to the hospital or seen a physician because they want you to get a radiology exam, such as an MRI or an ultrasound? Or you have to see a specialist or had to get a test done because your body's simply not cooperating? Did you know that there's a dedicated team that has to get prior authorization for these exams before they can be approved? My name is Crystal Cronk, and I'm a prior authorization referral specialist. I want to talk to you about the hardship of getting authorizations and the hoops that have to be jumped to get these approvals. So first things first, what is a prior authorization and how do you get one? Prior authorization is needed for the insurance company to approve an exam or test. Without one, the insurance company could deny coverage, and you, the patient, are fully liable for the charges. So once an exam has been scheduled, a call to the insurance company must be made, and the insurance company is looking for 4 things. Why did the patient come in? What are the symptoms and diagnosis? What exam is being scheduled? And what is the physician trying to rule out? Usually with the answer to these 4 questions, it gets an automatic approval. However, sometimes immediate approval isn't done and it has to go to medical review. Medical review is when the insurance company sends documentation to their physician or their nurse that has to go over it and figure out if this qualifies for authorization so that the patient can get the test done. Normally, we're called back in about a day or 2, and they give us the approval or denial. So how do prior authorizations get denied and why? First thing is it could not meet medical guidelines. For example, a patient wants to get an MRI done, but they just had an MRI for the same thing 2 months ago, and the images were remarkable, which means that there was nothing found. Usually, the insurance company is going to deny this because there's no reason to get another MRI, especially because the patient just had it done 2 months ago. Another is a different exam could be used. Something that, like an ultrasound compared to an MRI because it's less invasive. Or there's not enough clinical information. Another example is a patient can want to get a CAT scan done, but there's no reason for it. They don't have an injury, they're not in pain, and they haven't seen a physician in over a year. Normally, the insurance company is going to deny this because there is no reason for this patient to get the CT done. And lastly, the insurance has strict guidelines. For example, a lot of insurance companies won't let you get a routine colonoscopy unless you're over the age of 55. Or they're going to want to know, has the patient had physical therapy or at-home exercises before an ESI injection? An ESI injection is a steroid injection for pain. So after this, how do I fight a denial? I normally call the insurance company back and explain to them why we are doing this exam. Many reasons can help towards that, such as a patient that needs to get a colonoscopy before the age of 55. If this patient has family history of colon cancer, or the patient had colon cancer himself, this can help to get an approval because it is medically necessary for this patient to get it done. I can also ask to speak to a nurse or a physician to try to answer any questions that might help to get an approval. And last thing, if none of these work, then I can ask the physician that ordered the exam to do a peer-to-peer. A peer-to-peer is when the physician calls in and speaks to the insurance physician and states why it is medically necessary for this patient to get the exam. Usually this leads into an approval because when one physician talks to another, they understand why it is medically necessary and they get it approved. So what happens after something has been denied? There's really nothing we can do. We have to call the patient and let them know that it's been denied, and then it's their choice what they want to do. They can either go ahead and get the test or the exam done, but they would have to cover all the charges themselves without any help. Or they can decide that they want to cancel the exam. Another thing is the physician can order a different test to see if that can get approved because some other things are less invasive. Lastly, there's nothing that can happen after that. Once it's been documented and it's been denied, there's no further steps that can be done. So when you get a test or an injection, or even you need to go see another physician that's not your primary, it's not as easy as just scheduling it. There's a dedicated team that has to get authorization for you so you can get these things done, so that you in the end will not have to pay thousands of dollars to cover these things. So you can breathe a little bit easier knowing that there's people out there like me that are spending hours on the phone with these insurance companies to make sure that you get approved and fight denials. Thank you.